So either there is a problem somewhere through which an individual can be immunocompromised. Now, immunocompromised means that either the immune system is absent or is weakened. Now, the question again, I'm going to have an interactive lecture with me. Why we say it is weakened? What is the reason why an immune system is weakened? There may be thousands and one episodes which can happen. But if it is weakened, as I told you, for many different reasons. And what are the cells which are involved in that? All the cells which are of importance in the immune system, whether they are phagocytic cells, whether they are neutrophils or macrophages, whatever cells they may be. There may be absence of T cells, absence of B cells. There can be a combined absence of all the cells. So basically, when it is absent, is it something to do with genetics? Is it something to do with acquired? All right? And in many of these individuals, if a person acquires and becomes immunocompromised, it is because of factors such as environmental factors, nutrition, radiotherapy problems, people who have actually been have radiation therapies, people who have been exposed to radiations, people who have been sick for a long period of time, people who are malnutritioned, people like old people in our homes, they are immunocompromised. Why does it mean that it is immunocompromised? One or several cells may not be fully functional, or it can be totally non-functional. Some of these can be actually reversed back to its original and normal form. Some of these cannot be actually reversed, such as those in HIV cases. Now, the question here is that if a person is immunocompromised and you need to know what the factors are involved, then obviously once you know the factor what is involved, then you can take some management exercises there. Now, there is no preventive measures. Preventive measures are that you have to see that you do not get, or your patient does not get, unnecessary exposure to some of these agents which makes your cells, whichever cells they are, immobile, non-reactive, and has plenty of infections. So these are some of the things that you have to look at. Now, when you see those immunocompromised patients, whether they are nuclear explosions somewhere in Japan which happened, okay, and radiation came out of this, a lot of people died because they could not protect themselves. Radiation itself, massive radiation, can kill people. Okay? On other occasions, minor radiations can actually bring in more diseases, more infections in individuals. So now, I did tell you in my second or third lecture about Omen syndrome. This little boy who died at the age of 9 years, he was getting infections, especially in the skin, for quite a long time. And because his phagocytic cells, macrophages, neutrophils were not working appropriately, he kept on having repeated infections. Now, what would you do in patients like that? Or a patient who is immunodeficient, has no HIV, but for some reason is immunodeficient, what would you do? You would try to replace those cells. You would try to have a stem cell transplants in those people where there is a combined immunodeficiency syndrome. You may go and give extra protein nutrition to the older people when they come out of the sickness, or you go and give extra protein nutrition or supplement to the people who are starving. So these are some of the things that you can actually do. In the management part of it, you need to treat those infections, but as I said, treating those infections does not mean that their immune system is working perfectly. You may do it for a period of time till you need some replacement therapy. So basically what happens is the immune system in an immunocompromised patient is not properly functioning. Simple, no problem, right? When our cells don't work, we get diseases, whichever cells they are. And if they are infections, pathogenic bacteria and so on, and we get recurrent infections, then obviously there's a problem. If we get severe viral infections, opportunist infection, then there is a problem. If we don't have antibodies, then there is a problem. If we don't have protective measures, then there is a problem. So everything that we should have is, if it is not functional, that means that particular property or element of that immune system is taking us to several diseases. So it is very important that you act on immunocompromised patients. Now, the other form is of battling infection or immune response. We call it immunodeficiencies, which you already know. So I'm not going to go into immunodeficiencies. But if you look at HIV or AIDS patient, again, is what? Severe combined immunodeficiencies. So they cannot fight infections. If you look at pregnant women, they are also prone to infections because their immune system is diverted a little bit, okay? So they lose, I'm not saying fully or thoroughly, but to some extent they may be prone to infections. People who go for chemotherapy or radiation therapy for cancer, again, their immune system is suppressed so much that they are prone to infections. Now, all these terms where a person or a patient cannot fight infection, is a person who is immunocompromised. All right? So that's the absence of cells in the body or different factors or proteins which may be absent there. Now, what happens is, if you look at immunocompromised patients, they may have very severe infections. If you look at normal individuals, they may have less serious complications, okay? So again, what I'm saying is, all those infections which gets into an immunocompromised patient because one of or many of their cells or proteins are not working are basically exposed to opportunist infections. If you tell me that we also are exposed to opportunist infection, no. Healthy individuals usually don't. If you see patients with infections such as candida infections, then obviously it's usually a childhood infections, nappy rashes, candidas, so on and so forth, is something wrong with the baby. If you have candida infection because of some fungal infection has got into a healthy individuals, you have T cell intact which can eliminate these candida infections plus the treatment. But we don't get that so frequently as people who are immunocompromised. The other point here is the basic four major components of immune system which can lead to an immunocompromised host is basically your antibody-mediated B-cell immunity, your cell-mediated T-cell immunity, phagocytic functions, and complement. So these are important factors that we all should have. But if we don't have it, then obviously we will have opportunist infection. That's why, because we are immunocompromised with one of these components that we do not possess or they are not functional. Now sometimes it so happens that many of us have the cells. Many of us look as we have got immunoglobulins, but basically they are maybe not functional. Why? There may be several reasons why they are not functional. So if they are not functional, then obviously they are immunocompromised as well. So it's not the total absence of cells and proteins in a body, it's also that they do not function. Now, cytokines is one of them. So if we have a deficiency in the cytokine productions, that means there are some cells which are not producing those cytokines or interleukins. Again, regulation of these cells will fail in actually immune response that we need to have. Now, there can be children who have inherited gene defects and they can have B cell, T cell, combined B and cell, phagocytic cells complement. Complement is an essential part in two ways. Complement is an essential part in both the specific or acquired immunity and also non-specific. In non-specific, they have a chemotaxis approach. They also has opsonization process through which we kill all those bacteria. In areas of acquired or specific immunity, you need antibodies. If there's a virally infected cells, binds to these cells. You have complement attached, and complement pathway will take its course and try to lyse or kill the infected cells. So complement from that point of view is an important component by which we can eliminate many of these infections. Again, as I said, it is an important component such as antibody, and it is required in both these areas that we are talking about. The secondary immunodeficiencies in patients who have transplantation, splenectomy, immunosuppressive drugs, radiation therapy, HIV acquired. Why is it in transplantation a patient, you become a nephrologist, you become a transplant surgeon, and you want to transplant a kidney or any other organs into an individual, from one individual to another individual. How they become immunocompromised?
Because you give a medication, anti-immunity, to
immunosuppressant.
To save the new kidney.
So what happens is a person has to be immunosuppressed. Now, your knowledge will tell you.
For how long?
I'm just giving an example. It will be maybe lifelong if the kidney is transplanted, and the kidney may last 20 years, 25 years, 30 years, you still have to keep to support that there is no rejection. I tell you why. The first thing is that in kidney transplant, if you're doing a renal transplant or any organ transplant, you have to use your expertise and knowledge to see that the immunosuppressive drugs that you are giving to the patient is adequate to maintain the avoidance of rejection of these organs. So what you do is you titrate it. You titrate the drugs. If I get prednisolone as steroids, I probably might do with 5 milligrams of prednisolone. But some people gave me 100 milligrams of prednisolone. I almost lost my eye. I developed cataract here. And I had a surgery. So question is, why this effect and so much of immunosuppression somebody has to give me is maybe a wrong judgment. Because people who knew said, look, 5, 10 milligrams, 20 milligrams will do the work that you're supposed to have. Why 100? And in 100, when I started getting urinary tract infection. I'm talking about myself. I had cataracts, I had problems associated with immunosuppression quite a bit. I was getting flu, I was getting cold, I was getting many other infections. Now, as I said it, you don't give just one type of immunosuppression. You may give different types of immunosuppression for kidney rejections or organ rejections. Those are limited and titrated to an extent where it usually does not affect the immune system. However, those people who are receiving these low doses or optimal doses of suppression can still are prone to some infections. So it's not totally free of infections because their cells are not that normal functioning as ours. So there is a problem associated with this. And in terms of identical twins even, when they exchange organs, sometimes you will see that certain infections in those individuals will actually warrant your judgment to give some immunosuppression so that the new cells or the organs are maintained safe. So this is the judgment you will have to do that. Now if you look at splenectomy, spleen removal, there are cells maturing there, okay, including the thymus. Certain organs like thymus you can remove at an adult stage. But again, if somebody has a ruptured spleen because of the traffic accident or something, then obviously they are prone to bacterial infections, okay? And so they have to have some long-term injections for some years till they recover completely from those infections and builds up the cells that is required to be. Radiation therapy, some people, you don't go to the X-ray and say, okay, give me a total body irradiation. They give you only minute amount of radiation. Again, frequent radiation is bad because they want to protect your immune cells. They want to protect your immunity as such. If you receive things like people who have malignant neoplasm, okay, again, you need to irradiate. Now, I gave you a PBL on bubble boy syndrome. This patient, for some reason, did not develop T cells, B cells, or other systems, or even if they had the cells, he was unable to function. So you gave a total body radiation. When you give a total body radiation, you suppress everything completely. So this man, this boy in the tent, has no way to fight any infections. Even mothers and fathers can't touch him. So they put in a bubble till he gets a transplant. So that new cells, when they are generated, new stem cells, then possibly if it survives, it takes over the function of all the immune cells. So this is what it is. Till then, he's severely immunocompromised patient. So now, severely immunocompromised patient or compromised patients are those where you will see recurrent infections. Please don't sign for others. If you are immunocompromised, then obviously what happens is that you have to come out of it. If you do not come out of it, there may be some genetic problems. Now, there are certain techniques, there are certain things which are happening now. If there is a genetically inherited disorders, a baby is in the womb, these days they do penetrate, okay, into the baby. They probably try to do some genetic correction on that baby. Like for instance, if there's Down syndrome, something like that, they may put a gene which is not for Down syndrome. So I'm not talking about Down syndrome, I'm just saying an example. But there are genetic diseases which can actually benefit from actually gene transfer. So that can be done while the baby is still in the womb. But you cannot do all these gene transactions when the baby is born. It's difficult. So when they are growing up, they'll accept those genes, and those genes will become healthy genes within the baby when he is born. There are certain drugs you will give, and you know that there may be toxic drugs, have toxicity in there. You don't give that much. You use your judgment and say, look, I cannot give it because it may be nephrotoxins. So it can affect the kidney, it can affect other things. So you use your judgment when you should give, how you should give, what dosage it is, rather than giving a very high dose where you may destroy the kidney or the kidney function will stop. So this is what it is. The other secondary immunodeficiency is that if somebody has protein loss, who will have protein loss? Only? How do you lose proteins? Through excretion. If you take, even if people are hungry, they get little bit of protein, maybe some food is coming. It's not adequate. People who have problems, bowel syndromes, Crohn's disease, ulcerative colitis, okay, celiac disease, and irritable bowel disease, they lose a lot of water and diarrhea. And hence what happens is that those proteins are lost. So the amount of proteins that is getting into the individual is low. The amount is excreted out is sufficient, is quite a lot. And so there will be a problem associated with this. In older people, usually, what we do is we give them extra protein supplement, soya milk and then soya this thing and this and that, which has high protein levels, to improve and boost up the immune response. Otherwise, they'll be prone to infections. So protein is an important factor in the human body. You can have disturbance of normal microbial flora. What does it mean? As I said, people who have frequented diarrhea, loss of fluid in there, even in the skin, in anywhere, normal flora is lost. So you have got to put back the normal flora through oral cavity, through whatever it is, so that it gets into the gut, it gets into the other areas where these floras are, and it is essential that they maintain the immunity that is required. And I told you about irritable bowel syndrome and this 1 billion bacteria, which was completely devoid of in the gut, was put back and the person improved. So it is, even now, if somebody is sick, even when we are sick, and we have diarrheas and things like that, we go to supermarket and we buy Activa and all those yogurt things that we have, and we take it just to supplement the normal flora that we might have lost. It is an important thing that it is. If there is no normal flora here, obviously if there is a breach of mucosal and skin barriers, people will get infections as well. So you have got to protect from all points of view that you maintain skin flora as well. Now, what happens is that the medications that you use that can cause immunosuppression, again, as I said, I'm not going to deal with that because that is a part of pharmacology. Organisms that can cause severe infections in immunocompromised can be anything from common pathogens to a more sophisticated pathogen. So that can happen with anything. Bacteria, especially with the oral and pharynx or GIT, environmental fungi, also as I told you, mycotomas, candidas, etc., that can happen. Community viruses, cold virus, flu virus, which can afflict us. More people will be frequently have sickness than normal healthy individuals. So these are some of the things that you have to see. The other point here is, I have talked to you about what is encapsulated bacteria. Encapsulated bacteria, if there is a infection, severe infection in immunocompromised patients, where some of the cells are not working, what is encapsulated bacteria? Which is encapsulated? Which is in a capsule? Come on. Staph aureus? Yes? What else? Some mycobacterium, right? Encapsulated, cannot reach. Yes. So now, if the cells cannot reach because they are immunocompromised, then there is a problem. Even in immunocompromised patients, if you have encapsulated bacteria, phagocytic cells play a real role in eliminating those encapsulated bacteria by destroying, or you have cells which can release a lot of other soluble factors which can actually kill these infections which are in capsule form. So it's not a free flow infections. They are difficult infections. They have to be fought with proper immune system, immune cells, otherwise they won't be killed or eliminated. There are viruses, and these viruses can be herpes simplex virus. Again, they're supposed to be, do you know what VZV is and CMV? Come on. Varicella zoster virus. You know what a varicella zoster virus is? Poxes. You get chicken pox, you get other poxes, right? You have cytomegalovirus. Again, these are opportunist infections which will be there. And these are some of the common ones which may cause very serious infections. All right? Now, if you go to some country or in your area also, there's always a risk of foodborne or waterborne infections, which are again very serious infections. Now these infections, why it will be serious? Because the patient is immunocompromised. because the patient's immune system is not working, because their cells are not working. Any type, does not matter. As long as they are not working, they are. What happens in infections amplified when the infections, if some areas you go to are endemic areas, so you don't go there. But if you go there, you're compromising yourself as well. So if you are slightly immunocompromised, it will add up the load of immunocompromised host into infections which may be multiplied or doubled. And some of these are Salmonella infection, Campylobacter, Cryptosporidium, maybe severe or chronic, and depends what infections you have and how you can eliminate these infections. All right? So they can become a chronic infection if it's not cleared. Now, what would you do to a person? You're not going to give an immunocompromised person immunization. So I can give you an immunization now, and you will be protected from infections that have been immunized to you. Why in immunocompromised you cannot give immunization? Because the cells are not working, no antibodies will be made, no T cells, B cells are working, so obviously there's a problem. When you do immunization, it will have no effect. It will not create those protective measures that you have. Personal hygiene is again a very important aspect for you and for me and for those people, whether they are household, whether they are patients, whether we are normal individuals. So again, you keep your personal hygiene. Transmission prevention is if somebody is sick and you know it is sick and you know that it can be actually spread to other people, then obviously you take precautions. You may have masks, you may have other hand washing systems and so on and so forth. You can isolate a patient rather than getting. Now, the question here is, do we know if you are immunocompromised?
Maybe. Yes, by symptom. Maybe recurrent.
Correct. Usually, if you don't get a recurrent infection, and the same infection is not coming back to you, then you say, okay, right, I'm normal. I have a normal immune system going. I'm not immunocompromised. But people who have more flus, more colds, more viral infection, that means there is something wrong which is not working. Correct? So basically what it is happening is that people with recurrent infection, periodic infections, are those people who are immunocompromised, yes.
Doctor, maybe because of recurrent take or abuse of antibiotics.
Well, I told you, it can be...
How do you know that I am immunocompromised or from antibiotics that I take?
No, you see, there is a difference between sensitivity and resistance. If you send a blood or organism, you isolate the organism, put it on a plate, tell the laboratory, they have this for antibiotics. And what will happen is that if it is resistant, all the bacteria will grow towards that. If it's sensitive, all the bacteria will be killed. So that's why you know whether you are sensitive or resistant to particular antibiotics. Okay, that's a different issue altogether, which is not to do with immunocompromised patients. However, there are certain drugs which I told you can actually reduce your input of your immune system, your immune cells, and again, they may be prone to infections. Now, I'm not going to go into immunization at this particular time because I have a lecture with you next one. Okay, vaccination or immunoprophylaxis is interesting. And what I am saying is that in severely immunocompromised patients, because you're not certain whether the immune status is right or wrong, avoid live vaccines. They are not recommended because it can create more problems than it can actually cure in those patients. Okay? What will happen is that if you have less severe immunocompromised patients, okay, then obviously you have more benefits than risks involved with that. So again, only take risks when you're sure. Don't take risks when you're not sure. Again, as I told you, I'll go into this immunization and vaccination process. I'm not going to go through this. People who are also immunocompromised because they are taking high dose of steroids or prednisolone, as I was taking, avoid giving me vaccinations, immunizations, because it's a problem associated with giving me a live vaccines or whatever it is, and either I respond very badly or I don't respond at all, okay, depending on what it is. So again, you have to. You don't give corticosteroid therapy, and before administering a live virus vaccines, because the virus will not work, the vaccine will not work. You will not produce protective factors, antibodies, whatever it is, memory and especially of that vaccinations that you had. You have to wait for some time before you can do that. So that's what it is. In patients who are going to have immunosuppression before transplantation, you can give them vaccines, but at least 2 weeks before the transplantation you can, so that they are protected and they have already got those antibodies, protective antibodies. You can't give it after transplantation. You cannot give it at the time of transplantation. You have to give it a little bit before. Again, I'm not going to avoid live vaccines, okay? Nothing much. You will have to see what do you do to see that a person is immunocompromised? You do the functional laboratory assays, which can give you not only the counts, but it also gives you the true value of these immune cells working or not. So if they are working, that's fine. How do you know they are working? If you take blood from here, test for antibodies against all the immunized agent you had, then obviously systems were working properly. All right? So there are different tests that you can do. So basically, if you look at infections of childhood, bacterial, fungal, viral infections are very common in immunocompromised individuals. So how do you prevent it? Initially, what you do is that a person who is all right, give him adequate immunization. Again, as I said it, hygiene, transmission, prevention, all these are very important factors that you should have. Any question you want to ask me? I believe it was a short lecture, but it was adequate lecture so that you get a background of your immunodeficiencies, all the immune systems that is working. You have 60 questions. All those 60 questions will be on complement, immunoglobulins, cytokines, your immune cells, etc., the functions. All right? So please read, and they are coming next week. So I hope you will do good in this. Very good, not good. Very good, because the questions are simple. Just think. I may have twisted it a little bit, but just think. Think what I'm talking about, okay? And you will have a good time. Thank you.